Corneal collagen cross-linking with riboflavin, vitamin B2, and UVA light is a surgical treatment for corneal ectasia such as keratoconus, PMD, and post-LASIK ectasia. It is used in an attempt to make the cornea stronger. According to a 2015 Cochrane review, there is insufficient evidence to determine if it is useful in keratoconus. In 2016, the U.S. Food and Drug Administration approved riboflavin ophthalmic solution cross-linking based on 3 12-month clinical trials. Medical uses. A 2015 Cochrane review that looked at all high-quality evidence on corneal collagen cross-linking found that it was insufficient to determine if it is useful in keratoconus. Adverse effects. Among those with keratoconus who worsen CXL may be used. In this group the most common side effects are haziness of the cornea, punctate keratitis, corneal striae, corneal epithelium defect, and eye pain. In those who use it after post-LASIK ectasia, the most common side effects are haziness of the cornea, corneal epithelium defect, corneal striae, dry eye pain, punctate keratitis, and sensitivity to bright lights. There are no long-term studies about cross-linking effect on pregnancy and lactation. According to a manufacturer, cross-linking should not be performed on pregnant women. Cautions. People undergoing cross-linking should not rub their eyes for the first 5 days after the procedure. Procedure. Corneal cross-linking involves application of riboflavin solution to the eye that is activated by illumination with UVA light for approximately 30 or fewer minutes. The riboflavin causes new bonds to form across adjacent collagen strands in the stromal layer of the cornea, which recovers and preserves some of the cornea's mechanical strength. The corneal epithelial layer is generally removed to increase penetration of the riboflavin into the stroma, a procedure known as the standard protocol. People that are considered for treatment must undergo an extensive clinical workup, including corneal tomography, computerized corneal topography, endothelial microscopy, ultrasound pachymetry, B-scan sonography, keratometry, and biomicroscopy. History. The technique was first developed in Germany in 1997 by Eberhard Sporl and his team at the Dresden University of Technology. Approvals and clinical trials. In Germany, clinical trials have been in course since 1998. In Italy, routine interventions have been successfully performed since 2005. The standard protocol of corneal collagen cross-linking, with epithelium removal, is approved for use throughout Europe. In the United States, clinical trials commenced only in 2008. Based on 3 12-month clinical trials, the U.S. Food and Drug Administration approved riboflavin ophthalmic solution and KXL system for cross-linking on April 18, 2016, for the treatment of progressive keratoconus, and on July 19, 2016, for corneal ectasia after refractive surgery, making them the first FDA-approved treatment for keratoconus and post-LASIK ectasia. Research. As of 2016, research studying the safety and efficacy of corneal collagen cross-linking is ongoing. Transepithelial or epithelium-on, AP-on, cross-linking is a technique which was first performed in 2004 in the US. The corneal epithelium layer is left intact. In this technique, because the epithelium is not removed, riboflavin loading requires more time than with AP-off techniques, and may be less effective. In a pocket cross-linking procedure, riboflavin is injected directly into the corneal stroma via a corneal pocket in order to bypass the epithelium, which is left intact. Contact lens-assisted cross-linking, CAC-SLO, may be performed for people with corneal stromal thickness between 350 m to 400 m after epithelial removal. In this method, a precorneal riboflavin film, a riboflavin-soaked UV barrier-free soft contact lens of negligible power and a pre-contact lens riboflavin film are used to decrease UV irradiance to safe levels at the level of the endothelium. Topography-guided cross-linking relies on an active eye tracker to allow a patterned delivery of UV light. Both the power and pattern can be programmed into the unit based on the topography of the individual's eyes. Accelerated cross-linking would allow a shorter treatment time by delivering more energy, compared to the standard cross-linking procedure, which involves 3 mW of UVA exposure for 30 minutes.
Please subscribe and thanks for watching.